Hello everyone! Today, we're exploring a crucial area of public health, analytical epidemiology. This field helps us understand why diseases occur and how they spread. It moves beyond just describing health patterns. It dives deep into finding causes and risk factors. Think of it this way: descriptive epidemiology tells us who, what, when, and where a disease is happening. Analytical epidemiology then asks the big questions: why are certain people getting sick? How did they get exposed? It tests specific hypotheses about relationships between exposures and health outcomes. For example, if descriptive data shows more lung cancer in a certain area, analytical epidemiology would investigate specific causes, like smoking or air pollution. It primarily uses different types of studies to gather evidence. One common type is a cohort study. Here, researchers follow a group of people over time. Some are exposed to a potential risk factor, like a specific diet. Others are not. Researchers then observe who develops the disease. This helps identify if the exposure increases the risk. Another important type is a case control study. In this study, researchers start with people who already have a disease, the cases. They compare them to people who do not have the disease, the controls. They then look back in time to see what exposures might have differed between the two groups. This helps pinpoint past risk factors. Then there are cross-sectional studies. These take a snapshot in time. They measure both exposure and disease presence at the same moment. While useful for understanding prevalence, they can't always prove cause and effect as clearly. Finally, the strongest type for proving causation is the randomized control trial, RCT. Here, researchers actively intervene. They randomly assign participants to different groups. One group might receive a new drug. Another might receive a placebo. This controlled environment helps to establish a clear cause and effect relationship. Analytical epidemiology uses statistical methods to analyze data from these studies. It looks for strong associations. These associations help us understand disease mechanisms. They inform public health interventions. This knowledge is vital for developing prevention strategies. It helps create effective treatments. It guides policy decisions that protect communities. So, in essence, analytical epidemiology is about digging deeper. It's about finding the underlying reasons for health and disease. It's about turning observations into actionable insights. Thank you so much for watching and learning about analytical epidemiology with me today. If you found this explanation helpful, please give this video a thumbs up. Share it with anyone who might benefit. And if you want to support this channel and see more content like this, don't forget to hit that subscribe button. Your support truly helps. See you in the next video.